So now I'm going to be doing the postpartum assessment lab. So I have two oranges. I try to get two different in size to represent the fundus when I do the fundal assessment. So the first question in the lab manual says, how does the nurse prepare a patient for a postpartum assessment of the uterine fundus? So we can have the patient or the family member learn how to do the fundal assessment to assess the firmness of the fundus. But while she's in the hospital, the nurse will be assessing for the fundus to assess if it is boggy. If we have a boggy uterus, that may indicate that there's still excessive bleeding, which can cause postpartum hemorrhage. The patient is encouraged to void before palpitation of the uterus fundus. And this is because a full bladder can displace the uterus and can lead to excessive bleeding also. So if I first come in, I will knock on the door, wash my hands, introduce myself. Hi, my name is Catherine. I'm going to be your nurse for today. Can you please tell me your name and date of birth? I will verify her wristband and ask for any allergies. I would ask the mother how she's feeling. It is most likely normal for her to say that she's, tired or she didn't sleep well. She's experiencing some pain or having postpartum chills, which is also related to, like the nervous system and the vasal changes in the shifts of the fluid. So first, I will be assessing the fundus. In order to assess the fundus, the woman will be supported by a pillow. I will have my hands on like a karate shaped form. I will have my hands on the symphysis pubis and then also by the umbilicus. So I'll be going on and massaging to assess where the fundus is. So I'll just say that this woman was 12 hours postpartum, and I feel the fundus at the two finger breaths mark, which indicates that it's a little bit below the umbilicus. The fundus at the end of the third stage of labor should be 2 centimeters below or halfway between the umbilicus and the symphysis pubis. If it's 1 hour after delivery, the fundus should rise to the level of the umbilicus. So usually after labor, the fundus is usually at the umbilicus at this point. And if it's 24 hours after, the fundus should descend 1 to 2 centimeters. And then after 2 weeks, the fundus should lie within the pelvis and it should no longer be palpable. So with the oranges, if the fundus is boggy and soft when we're palpitating the fundus, this will indicate that she's still having vaginal bleeding. We would want to give her oxytocin to stimulate the contractions to help with constricting the cervix to stop the bleeding from happening. So the normal characteristics of a fundus should be firm. So this is the firm orange. It should be firm and midline. And if it is abnormal, it will be boggy, and it would be or if she has a distended bladder, it could descend to the left or the right of the uterus as well. So, we want to make sure that we have clean gloves on us also, and explain the procedure to the woman. If we're massaging the fundus, we want to make sure that we're supporting the symphysis pubis and doing the round strokes and massaging the fundus until it becomes firm. We want to palpitate, and we want to cup one hand against the symphysis pubis, like I said, to support the lower segment of the uterus. And we want to document also the fundal height, the location, and the uterine consistency. If the fundus is firm or boggy, we want to document that. And then if it's boggy, indicating that it is not firm, we want to lightly do circular motions to massage the fundus in order for it to become firm, and also administer oxytocins intramuscularly or IV. And we can also give other medications such as methylene, gornovine. Sorry if I pronounced that wrong. Methylargoline. To help also with stopping the excessive bleeding as well. So The next question on the lab is, what is the characteristics of lochia during the first 1 to 3 days post-vaginally? So the lochia for the first 3 days after delivery are dark red in color. A few small blood clots, not bigger than a plum, is normal. So there's 3 stages of lochia. So the lochia rubra is the light red color, which is bloody consistency, fleshy. It has a fleshy odor and it contains small clots, which is normal, and it lasts 1 to 3 days after delivery. So that is the type of lochia we're looking for in the first 1 to 3 days of post-vaginal birth. So we're definitely looking for lochia rubra. So the next question is, describe the difference in the amount of lochia. So 1 second. So if we have heavy lochia, the pad is going to be saturated within 1 hour after changing it. So we always want to assess the perineal pad and also ask the patient the last time she changed her perineal pad. If we're noticing heavy lochia, we also want to determine how much blood loss the patient is having. So we will take the perineal pad, change it, make sure that we're cleaning the perineal area with the peri bottle, warm soap and water. And she can also be doing this sitting over the toilet. So we're making sure, because she's very prone to infection at this point. So we also want to make sure that, she had a cystectomy or any type of repairs or lacerations or perineal tenderness that we're assessing for that too, because we don't want to have any infection. So if she's having heavy lochia, we will measure the lochia by weighing the perineal pad to determine the approximate blood loss. If she's having moderate, she will have 4 to 6 stains with an estimated of 25 mLs to 50 mLs of blood discharge or saturation. If she's having small lochia, this will be an approximately 4 inches of stain or a 10 ml to 25 ml blood loss. And if it's scant, it'll be 1 to 2 inches in lochia stain on the perineal pad and approximately 10 ml blood loss. So there's also 2 different stages of lochia. There's lochia serosa, which is the pink brown color with sanguinaceous consistency, which lasts approximately day 4 to day 10 of after delivery. And if she's having lochia alba, this is the yellow, whitish, creamy colored, fleshy odor, which lasts approximately up to 11 days or 4 to 8 weeks after postpartum. So like I said, we're going to do an assessment on the lochia. We're going to assess the quantity of saturation. If it's scant, it's less than 2.5 centimeters. If it is light, it's 2.5 to 10 centimeters. If it is moderate, it's more than 10 centimeters. And if it's heavy, 1 pad saturation would be within 2 hours. Excessive bleeding, 1 pad in 15 minutes or less will indicate that there's excessive bleeding or pooling of blood. So when we assess the lochia, we want to assess the color, the amount, and the consistency. And we want to massage the uterus, or ambulation can result in the gush of lochia, so that can have the dark blood in the pool and the trickling of blood after postpartum vaginal birth. And we want to assess for any signs of infection. So the next question is, what is the typical smell of the lochia? So the typical smell of the lochia is defined as a musty scent or fleshy odor with the size of the clots will be small. But if she's having foul odor to the lochia, which will indicate a sign of infection. So if she's having foul odor, like I said, will suggest infection. If she's having really large clots as well, that can be a sign of infection as well. But definitely the smell of the lochia will determine that we need to do additional intervention and then notify the physician as well. Also, when we're doing a postpartum assessment, we're assessing the bubble, which is an acronym that stands for B stands for breast. So we want to assess the breast for any type of engorgement or mastitis. If the woman is complaining that she's having one area of pain in her breast or any crackles or pain in her breast, that can indicate mastitis. If she is having mastitis, we will notify the physician to prescribe an antibacterial cream that she will still apply to her breast, and she will still encourage her to breastfeed. If she's having any engorgement, we want to tell her, to take a warm bath before she breastfeeds and to apply cold compresses in between breastfeedings. But we also want to encourage her to empty out all of her breast milk when she is breastfeeding, and also to encourage her to use her finger to separate the suckling and the latching of the baby when they're breastfeeding to avoid having any type of pain or infection to the breast. Also, U stands for uterus. So like we did, we assessed the uterus, the fundal height, the uterine placement, and the consistency of the uterus. So by doing that, we will do the fundal height, which we also assess. We'll do the indications when we're assessing the fundus, the uterine fundus. When we're assessing to see where we feel the uterus at that point, we will indicate that as finger breaths, to determine how far it is away from the umbilicus while we're supporting the uterus with our hands at the symphysis pubis. So we will also document the